Yes, we can.
Yeah. Thank you for that introduction. I will be talking about early recognition of sepsis. So in this, I will talk why we need to do an early recognition, when to suspect, and how to recognize, and also what can we do to improve this process of recognition in our institutes. So to start, why we need to recognize early? That early recognition, of course, will lead to better outcomes. Why? Because this is a very time-sensitive condition. As you heard from the previous speaker, the high mortality and morbidity in case we do not manage the patients quick enough. So only by early recognition, we will be able to uptake the care bundles, which we will be discussing later on this program. And then only we can manage and improve the mortality and morbidity. Let's see how it is. Now, if you see this graph, x-axis being time and y-axis being the patient survival, you see that if you administer antibiotics within the first hour, the patient survival is nearly more than 80%. Whereas if it delays up to 24 hours, you see that the patient survival rate drops drastically to 10%. Similarly, if you look at this, the green line, the administration of intravenous fluid, if you do it early, less than 1 hour duration, by 4 hours, the mortality percentage has drastically dropped. However, if not, the mortality increases. Now you understand why we need to increase awareness of this sepsis, as well as try to identify it as much as possible, quickly as much as possible. So as a whole, like if you are in a primary setting or in a district hospital or even in the teaching hospital or even in the ICU, if a patient is having a possible infection, a possible one, not obvious, but maybe sometimes very subtle. But if you suspect there is some kind of infection, and if the patient is unwell, please ask, just ask, could it be sepsis? Always keep this in your back of your mind, because we tend to miss a lot of septic patients early in the admissions or presentations. So how we are going to do it is, we will discuss the definitions first. From the definitions, we will try to identify the patients. So definitions, as you heard earlier, sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to infection. So infection, life-threatening, dysregulated response, and organ dysfunction. So if you can show these things are present in a patient, probably you can think the patient is having sepsis. And the septic shock is another subset. We will talk about it in later. So if you look at this, now infection, not all patients with infection go into sepsis, only part of them. But to find the sepsis, the patient needs to have a dysregulated response as well as organ dysfunction. Now, how are you going to objectively say the patient is having this organ dysfunction in addition to probable infection? So first thing is you have to have a clinical sense, where if we use this word sepsis as a mnemonic itself, you can see if a patient comes to you with these signs and symptoms, shivering, fever, or very cold, either way, extreme pain or general discomfort, pale or a discolored skin, sleepy or having a level of consciousness a little bit less than normal, then they might feel like they are going to die or short of breath. So if these signs and symptoms are there, of course, you have to think whether this patient is having an infection plus an organ dysfunction, right? Sometimes you see if a patient comes with fever, dysuria, cough, shivering, those things are, everyone knows that these are signs of an infection. But of course, not all patients come with these obvious signs and symptoms. Some are very subtle, and you have to have this clinical sense to identify whether the patient is having an infection and a dysregulated response to it, right? Some having infections may be all right, but not all, right? So now we will see how we are going to say a patient is having organ dysfunction. Right? For this, we use scoring systems. Right? So there is no single scoring system that is recommended to use as a single tool. Right? Earlier recommendations were to use QSOFA, Quick Sequential Organ Failure Assessment Score, as a screening tool to identify sepsis. But in the latest recommendations, what they say is not to use it as a single screening tool, but use more than one. What are those available to us? As earlier mentioned, SIRS criteria, QSOFA, SOFA, NEWS, MUSE, SAPS Apache, a lot of things. If we go one by one, now SIRS is systemic inflammatory response syndrome. Criteria are having a high or low temperature, high heart rate, high respiratory rate, high or low white cell counts. There are numbers, but these 4 criteria out of, if there are 2 or more positive, we say the patient is having systemic inflammatory response syndrome. But that all patients with SIRS is not from sepsis. Some like burns patients, pancreatitis patients, they can also have these signs and symptoms. That is why we say not to use single screening tools. But you can use this. Suspect. Is this patient having a organ dysfunction? Or you can use this QSOFA, again not as a single tool, but it's very easy. It has only 3 criteria: hypotension, altered GCS, and tachypnea. Out of which, if 2 or more becomes positive, there is a high risk. And of course, the patient has to have a possible infection as well. And then you can say if there are more than 2 points, the patient is having sepsis. Right? But remember, some other clinical conditions also can have these signs and symptoms. So always consider another scoring system. So far score, the proper sequential organ failure assessment score is used in most of the time in our ICUs. But here we look at respiration, coagulation, liver, cardiovascular, central nervous system, and renal systems. And we give a score depending on the values of these parameters. And if you see a higher SOFA score, more than 2, of course, if the patient increases the score gets higher than their previous score by 2, then we say there is a possible organ dysfunction in this patient. And if there is sepsis, if there's an infection, we can say possible sepsis is there. Or we can use National Early Warning Score, Modified Early Warning Score, or any other scoring systems we discussed earlier. So whatever happens, what you have to do is look for an infection. Is there a dysregulated response, right? Or is there organ dysfunction? If you find it, then think this could be sepsis, right? Now, once you know that the patient, if you suspect the patient is having sepsis, then you have to immediately start your management. Do not wait for other tests, right? So immediate management, we will discuss it later on today. While implementing it, right? While implementing it, you can send your other investigations to confirm the diagnosis or to look where the infection is, like liver functions, renal functions, coagulation, CRP, WBC disease, and also to look for a focus. You can use imaging studies as well. And if you suspect a specific illness, like say, for instance, leptospirosis, you can send leptospirosis antigens antibodies. But these tests results, it gets late. So that's why we need to identify patients using our clinical sense, having an infection, and the scoring system, right? So that we can start our management before the confirmation by other tests. But what is the other test we use in our nearly the first hour bundle of care? What we should take is cultures. That's very important to identify what is the microorganism causing this infection. Now, cultures, you have to take prior to antibiotic administration as much as possible. If it gets delayed, of course, you can give the antibiotics first, but the recommendations are take cultures as much as early as possible. Do both aerobic and anaerobic cultures, and also from the possible infective focus. Now, we can also have other tests also. Nowadays, there are molecular techniques like PCR, MALDI-TOF, novel techniques like genome sequencing, or even the patient phenotypic sequencing. But these are not in the picture as yet, especially in Sri Lanka, we don't have it. PCR, of course, we have other tests, no? So these may come in the future, but not at the moment. So stick to cultures, right? And then about procalcitonin, it is not recommended to have procalcitonin as the specific diagnostic test, right? But you can use it to limit antibiotic use. Now that is sepsis. Now there's another subset of this which is septic shock. Now, to say septic shock, the patient should have persistent hypotension despite your fluid management and or higher lactate level. So you look for that so that you can identify septic shock early. So if a patient is having infection, right, and there's organ dysfunction, and in addition, if they have MAP of less than 65 despite your fluids and no needing a vasopressor, or if there's lactate levels more than 2, you have to suspect the patient is in septic shock and institute your management as early as possible. Now the trend is coming now to use capillary refill time to use as instead of lactates for especially underdeveloped countries where lactate is not available. So capillary refill time can be used to identify shock, and the recommendations will be coming sooner. So that's how we identify sepsis and septic shock, screen early. And then how are we going to do this in our institutions, right? So many patients come to our hospitals with different kind of symptoms and signs. If they have an infection, please implement a sepsis pathway. Then emergency care assessment and treatment protocols should be implemented, and make sure that it is sustainable as well. So have a sepsis pathway and then make it sustainable, and then update regularly along with emerging evidence and guidance. So in Sri Lanka, we have kept a step forward. Now the Ministry of Health Sri Lanka has a national early warning score chart implemented. So we can use it to identify organ dysfunction in these patients. So to summarize, in early recognition of sepsis, you have to look for signs of an infection and then look whether there's an organ dysfunction. For that, use multiple scoring systems, not a single tool. And then look for signs of shock. Then you confirm your suspicion whether it's sepsis or septic shock and institute your management early. Then, of course, use specific tests like cultures to identify the focus and the positivation, and implement sepsis pathway in healthcare institutions. So like this, you can early recognize sepsis. So suspect sepsis and save lives. Thank you.